NBC5 responds. For months, our team has been digging into a growing scheme of fake medical labs and phony medical providers who are really cashing in on your stolen insurance information. And here's the kicker. The fraud could mean your medical care is denied when you actually need it. PJ Rendawa tracked down almost a dozen phantom labs set up across the city.
Strange medical bills, providers they'd never heard of. The Larson family's health insurance was under attack, and they had no idea.
This is all money that Blue Cross Blue Shield has paid out to these people for services that we never received.
Deborah first noticed the strange lab charges on their Blue Cross Blue Shield insurance explanation of benefits last summer.
And they were all labs, and I knew, exactly what labs I had done, and I knew they weren't right.
Each week without fail, lab charges for diagnostic pathology were being billed under either Deborah or her husband Lance's name.
Sometimes we might get one or two. Sometimes we get a FedEx box full of them.
Sure, the Larsons weren't on the hook for those thousands in bogus claims, but they wanted nothing to do with the fraud.
Somebody's got my information, and they're using it for fraudulent purposes.
That's when the couple came across our NBC5 Response investigation from earlier that year.
To con insurance companies into paying out some big bucks.
Oh, wow, this is the exact same thing that's happened to us, and it's called phantom billing.
The couple say they reported the phantom bills to Blue Cross Blue Shield multiple times. They were even issued new health insurance policy numbers, but that didn't stop the fraud. Why? Well, we don't know. Blue Cross Blue Shield told us they couldn't comment specifically on the Larsons' case. But after that...
Did you ever hear back?
No.
In total, the Larsons' health insurance was billed more than $84,000 by 7 different lab companies with names like Rainbow Lab, Safina Enterprises, and Icon Events. We had questions. So that's when NBC5 Responds began calling each and every one of these labs that billed the Larsons' insurance.
Please hang up and try your call again later.
So almost all of the dozen phone numbers we just called were out of service.
Next, we headed to all the addresses we could find associated with the 7 labs and their registered agents. A few addresses took us to cultural learning and donation centers. But no one we spoke to knew anything about the labs that were supposed to be there.
We have a eviction notice.
The majority of the addresses took us to empty offices and storefronts. But people working next to these offices and businesses told us the same thing again and again.
Never seen anyone in there.
The thieves have really moved over to healthcare and really taken it by storm.
Scott Speranza with insurance verification company HealthLock explains most phantom billing fraud originates from data breaches. According to the HIPAA Journal, more than 133 million patient records have been exposed in data breaches since 2021.
What happens is a fake billing company gets set up. They purchase group numbers, identity, ID numbers, Scott Speranza, my group number, and they submit a claim on my behalf. They receive money from the carrier, they shut down, they're a ghost, and now they've created all this havoc.
Speranza says many insurance companies use automation to process lower cost claims, so the fraud isn't always caught. But the insurance company isn't the only one paying the price.
I also could be denied a claim or partially denied because I've quote unquote ordered received that service.
And as their fake claims rack up, that's a worry that plagues the Larsons.
If it's happening to us, it's probably happening to a lot of different people.
We shared the results of our investigation with the FBI. A spokesperson there says they can't comment on any next steps they may take. Both the FBI and Blue Cross Blue Shield urge people to take a close look at their explanation of benefits to stop fraud like this. Now, most EOBs may say this is not a bill, but you could still end up paying for those services in the long run. So be sure to report any charges you don't recognize. PJ Rendawa, NBC5 Responds.